Hello everyone, this is Dr. TSR. Today I am here to share with you what is the MSOG curriculum as per Dr. MGR University. Okay, so this is the curriculum from 2020 onwards. So they have some goals, objectives, and then when it comes with the first year is mainly for ops. Like you should know what are the health needs of a woman and what are the things which you need to practice at the community level, and you have to interpret all the various lab tests. Then you should know something related to sterilization and disposal of medical waste and related to statistics. That is first year. Then coming to second year you should know something related to genetics, and then you should know about postmenopausal women related health and all gynec conditions, benign and malignant, and then STD related, AIDS related things. So that is the reproductive health of the woman as well as in the adolescent group. So second year is mainly for gynec. So when it comes with third year, you should know something which is related to medical legal aspects. Okay, medical legal aspect, MTP related things, and PNDT Act. Then still more related like endocrinology and then infertility. Okay, so then you should know how to treat the mother with HIV, and so all those vital points in the OG. So the very keen, very smooth points. So that like medical legal aspects, HIV and infertility, endocrinology. So that is with respect to third year. First year over, second year. First year with respect to ops over, second year with respect to gynec over, third year with respect to law over. So then what and all you should know. You should know like ethical issues, legal issue. You should know what is confidentiality, risk management, all these things we will do. Okay. So then coming to the procedures. So procedure performed in first year. Procedure performed in first year: episiotomy, delivery, so venesection. Then you have to do endometrial biopsy and cervical biopsy, which we usually do in third years, and dilatation and curettage. This is the thing which you should do in first year. That is the procedure performed as per the curriculum. So and other diagnostic procedures like you should do HSG. You know how to interpret the X-rays in the abnormal pelvis, and you should do normal pregnancies. You should do Pap smear. This is first year. Then second year you have to do internal podalic version. And second year, you are supposed to do cesarean hysterectomy. You should know what is internal iliac artery ligation. So we should know cesarean hysterectomy procedures observed. Yes, we will be observing. So what are the things which you should perform is you should know how to put forceps and how to put vacuum in second year. Second year syllabus, how to put forceps, how to put vacuum. Then comes manual removal of placenta, caldosynthesis, then colpotomy. We'll do manual removal, caldosynthesis, colpotomy, and opening and closing of abdomen. All should be done. At least 10 must be done. 10 must be done. That means by second year, from skin to skin, at least 10 they are telling. Okay. So that is the procedure which is performed. Then diagnostic procedures. So like you know how to do biophysical profile, how to interpret abnormal pregnancies, how to do scan, any gynec pathologies, and fetal surveillance and colposcopy will do. Then coming to third year, you should know tubal microsurgery. You have to observe, okay. And gynec malignancy radical operations only when you get gynec onco postings or else with the interest. That is the radical operation for gynec malignancies. Then genital fistula, again urogynec posting. Then operation for incontinence, again urogynec posting. Then you should observe myomectomy and laparoscopic hysteroscopy. So what are the procedure to be performed? You have to do C-section in third year, and you have to manage obstetrical genital tract injuries, that is obstetric anus pictal injury complex. Then you have to do postpartum sterilization. PS, less likely to get the chance. PS, postpartum sterilization you should do. Mini lap tubal ligation should be done. That means LS, laparoscopic tubal ligation, should be done in third year as per TNMGR University syllabus. And we should do MTP. Okay. Operations for POP, that is VH, vaginal hysterectomy has to be done. Ovarian cyst operation procedure performed. Operation for ectopic pregnancy, ectopic management, and vaginal and abdominal hysterectomy. These are the procedures which are to be performed in third year. So and then diagnostic procedures like amniocentesis, endoscopy, laparoscopy and hysteroscopy. So this is in brief about the procedures to be done performed during first year, second year and third year of residency. So other than this PDF contains syllabus. So be thorough with whatever the syllabus topic which is given, like anatomy, then what is the physiology, then regarding the immunology there will be single question, then gametogenesis, oogenesis, then fetus anomaly, fetus skull, that will be there for viva. When it coming with the placenta circulation will be asked, the fetus circulation will be asked. So all the physiological changes you should know. When it comes with endocrinology, mainly corpus luteum they will ask, corpus luteum and Graafian follicle, and even the lactation is important question. Then coming to the special topics like pharmacology, you should know what are the drugs which are used, and its complete details. Then coming to the genetics mainly they will ask for amniocentesis and choriosynthesis. Here they have asked some chromosomal abnormalities. Okay, that is the non-invasive method of prenatal testing and even the prenatal diagnosis. Then when comes with the hormones, you should know like estrogen, progesterone, CRM, SSRM, everything. And you should even know the gynecological related drugs and even the neuroendocrinology which is related to reproduction. So these point now, this whatever they have highlighted, that point will be there in the textbooks, and that you should not forget to not to read. Right, clinical obstetrics, how do you diagnose the pregnancy? Okay, then antenatal care regarding the surveillance, then what are the complications. So they will give, see, pulmonary disorders mainly they have given asthma in pregnancy, so so focus more on asthma related things. Then coming to the early pregnancy complications, abortion, ectopic, even the molar hyperemesis gravidarum, newborn obstetric complications and the imaging studies they have given. Then when it comes with intrapartum care, they have given related to labor, abnormal labor. Kindly go through the Arul Kumaran textbook of labor, that is more important. Then how do you care in the postpartum period? Postpartum sepsis, puerperal sepsis is again an important question related to newborn, all the topics. So this and all they will ask in exam, like mechanism aspiration syndrome 7 marks, respiratory distress syndrome 7 marks, and how do you treat a newborn with asphyxia. So that will be there. So that is in the paper 2. Then coming to the paper 3, fibroid is important. So polyp, then endometriosis, hyperplasia, POPs, benign lesions, cervix, vulva, vagina, then ovary. So then comes malignant genital neoplasias, so which is related to sin and uterine endometriosis and ovarian CA mainly. So then how it is the development, even the embryology is important, and even the congenital malformation, that is our Mullerian anomaly, is important. So you should practice more of writing the diagrams. Then comes endocrinal abnormalities like hyperprolactinemia is more important. Okay, and even the PCOS, hyperprolactinemia and then PCOS. So you should know about amenorrhea in and out. Then infections, mainly the genital tuberculosis and PID. Okay, so urogynec they will mainly ask about incontinence. And then coming to the infertility, they will mainly ask about the ovulation induction agents. So that is main important. And other than this, they can ask about surrogacy, and they will ask about ART, artificial reproductive technology loss and all. Endoscopy, they will mainly ask about the what are the ergonomics, and what are the different procedures, what are the different points used in endoscopy, and advantages and disadvantages. Then coming to the statistics, they will ask mainly about what is define MMR and what are the causes, like that they will ask. So when it coming with the contraception, they will ask specifically about some contraception, and they will ask in detail like lark or a sponge or female condom, like that. Then coming to the MTP, what are the different methods, and first trimester how do you do, second trimester how do you do. So then whatever any problems which are newly launched by the government of India or the government of Tamil Nadu, that they will ask. So okay, then paper 4. Paper 4 is mainly whatever you do in seminars and journal club and symposium group discussion. All those points will come here. Okay, that mainly the elagolics, what is elagolics, and what are the different types of ART techniques, what is surrogacy, ART law. So all those things will come again in the recent advances. So that is the brief about what is paper 1, paper 2, paper 3, paper 4 contents. So then they have given how do you train your PG students. So first year is mainly for theoretical knowledge, basic sciences, as well as acquiring the skills how to do interpret the investigations and do the case recordings. So surgical skills you have to assist and then observe, that is as a second assistant. So MTP, tubectomy, laparoscopy, all DNC and all. So second year is mainly for theoretical knowledge plus allied subjects. So you should now you should be first assistant and you should acquire the surgical skills and should be able to manage all the complications during the delivery. You should attend conference and workshop. That is the time period. That is the second year. First year is the time where we should adjust and we should learn. We should write the records. We should get all scoldings from the seniors and we should get trained with them also. That is the thing which is there. Second year is the period where we will be free. So we should attend conference. We should attend workshop. We should give more of lectures, seminars, symposiums, everything, and assist more of the cases. And journal clubs should be done in second years. Records has to be maintained and has to be completed. Logbook has to be completed by second year. When it comes third years, again it comes again like a fire in a belly. You have to sit and study. You should assist. You should do the cases. So here now you have to compile all the basics things whatever you have learned theory with the practical. So like all C-section, hysterectomies, reconstructive surgeries, all things should be done. Teaching activity, you should start teaching to the juniors and that is what is in the third year. Okay, so when it comes with the exam, before that they have given the posting. How many months? 3 months. First, second, third year. And then how much antenatal care, that is AN ward you should know, AN ward and PN ward, gynec and postoperative ward. Then these are the specialties which we should go actually. That is the radiology, that is the radiology. Go there and learn the ultrasound, both obs and gynae. Then radiotherapy, again in the radiology department. IVF and infertility in reproductive medicine. Neonatology, pediatric workshop should be the pediatric postings. Anesthesia, we should know what is painless labor. Painless labor is a thing which is gaining so much importance nowadays. Then we should go for oncology department, medical onco as well as surgical onco, and even we should go for urology department, and we should not feel afraid of urinary bladder. And even the diabetology and medicine, because GDM is most common. So these are actually the minor postings which we should go. So okay, that is about the how they will schedule the training in during the PG period. Then teaching means you should give lectures, different types of lectures they have given. Okay, you should give lectures and journal club and symposium has to be done. You have to present more and more cases, then only will get confidence while presenting the case during the exams. And attend the ward rounds. There should be grand ward rounds and all. So then only we will be, when attending the ward rounds, we will be able to briefly explain the cases to the assistants. That ward round will be there even during the final year exam. So we should know what is ward round. Then we should attend all the interdepartmental meeting and any clinico-pathological meeting and attend the CMEs and maintain the logbook. Whatever you do each day, just update it in the logbook. It can be just attending an seminar, conference, just update in the logbook. Then coming to the dissertation, which is most important and it carries 100 marks. And be always updated about your dissertation to your guide and as well as to the chief, so that when it comes at the last end, you will not be afraid or you will not be in a hurry to complete it. So there will be page limit. So it is 100 pages actually. Your dissertation should be less than 100 pages. That thing you should know. So get the ethical committee clearance in the first year itself. Ethical committee clearance getting is in first year itself. And VCBR, doing VCBR again, it is in the first year itself. So that is the thing you should know. So then coming to the this is appraisal form that they will not do actually. So coming to the paper 1, again all paper carries 100 marks, total is 400 marks. Okay, so then when it comes to the viva, so that depends on your institute how much marks they will put. So here they have given 1 ops, 1 short case, 50 marks usually. So maybe like that only, 1 ops and 1 gyne is 50 marks. Then you have 2 long case will be there and 2 short case will be there. Depends on the institute how they will give the cases. And then viva, just a grand viva contains 100 marks. When you present a case, there will be viva. Other than that, there is a grand viva that carries 100 marks. Then instruments, drugs, then CTG, they will put pelvis and specimen. All these marks will be there. So again, instruments and family planning, the contraception will be there. So total, they have told theory 400. So practical viva, that is 200 plus 300. So grand total is 700. That is what they have told. Okay. So for pass, you should have to get to at least 50% in theory and practical. So then that is that 40, don't consider this 40, consider only 50 that is there. Okay, so this is in brief, and recommended books very nicely they have given. So you are able to study iron donut, we can study areas, we can study Williams, just go through the tables. Actually Jeff Coates book is very nice. So here the whatever the flow charts are given na, that is very nice in Jeff Coates book. Then Datta nowadays they are not considering because they think it is a nursing book, but it is good actually. Then Oxenford's very difficult to read. Instead we can read Arul Kumaran, and Mudaliar has to be read. Then Lakshmi Shishadri, we can go through it. So that is about actually the recommended books. And when comes Kainak, again Datta Shah and T. Linde, again go through the pictures, paragraphs, again go through the tables. And Lakshmi Shishadri we can study Barak and Novak again for gynec oncology. Again just see the tables. That's what we can do as a basic PG students who has worked like anything in the last 3 years, and the last 1 month what more we can study is these things we can study. And Williams, again Williams I always prefer going to the tables because not from A to Z we can remember. Okay, so the journals be updated about Foxy journal, and remaining all are just going through the journal while presenting in journal club. This is in brief about MS. What is MS? What are the topics are there? What are the things which we should know in first year, second year, and third year? This is what is most important for a basic postgraduate. So this is Dr. TSR. Kindly subscribe to my channel, and thank you.